Are you considering using NuvaRing as a form of hormonal birth control? Before you make a decision, it's important to understand the potential side effects and risks associated with this contraceptive method. In this video, we will delve into the topic of NuvaRing side effects and provide you with the necessary information to navigate its risks effectively. Understanding hormonal birth control options. When it comes to preventing pregnancy, hormonal birth control methods are a popular choice among women worldwide. These methods work by altering the hormonal balance in the body to prevent ovulation, thicken cervical mucus, and thin the lining of the uterus. This prevents sperm from reaching the egg and implanting itself in the uterus. There are various types of hormonal birth control options available, including birth control pills, patches, injections, and vaginal rings like NuvaRing. Each method has its own advantages and disadvantages, and it's essential to consider factors such as convenience, effectiveness, and potential side effects when choosing the right option for you. What is NuvaRing? NuvaRing is a small, flexible vaginal ring that is inserted into the vagina to provide hormonal contraception. It is designed to release a combination of estrogen and progestin hormones over a 3-week period, after which it is removed for a 1-week break, during which a withdrawal bleed occurs. After the break, a new NuvaRing is inserted to continue the cycle. One of the key benefits of NuvaRing is its convenience. It only needs to be inserted once a month and does not require daily administration like birth control pills. Additionally, it is discreet and can be worn during most activities, including swimming and exercising. However, it's important to note that NuvaRing does not protect against sexually transmitted infections, STIs, and is solely intended for pregnancy prevention. Common side effects of NuvaRing. Like any hormonal contraceptive, NuvaRing can cause side effects. While these side effects are generally mild and temporary, they can still affect some users. Common side effects of NuvaRing may include mood swings, headaches, breast tenderness, nausea, and vaginal discomfort. These side effects typically subside after a few months of use as the body adjusts to the hormonal changes. It's important to note that the occurrence and severity of side effects can vary from person to person. Some individuals may experience no side effects at all, while others may experience more pronounced symptoms. If you experience persistent or severe side effects that are affecting your quality of life, it is advisable to consult with your healthcare provider to discuss alternative options. Serious risks and potential complications. While NuvaRing is generally considered safe and effective, it's crucial to understand the more serious risks associated with its use. Like other hormonal contraceptives, NuvaRing carries a small increased risk of blood clots, stroke, or heart attack. The risk is higher for individuals who smoke, are over the age of 35, have a history of blood clots, or have certain medical conditions. Blood clots can be life-threatening if they travel to vital organs such as the lungs or brain. Warning signs of a blood clot may include sudden shortness of breath, chest pain, severe headache, numbness or weakness in the arm or leg, or difficulty speaking. If you experience any of these symptoms, it is crucial to seek medical attention immediately. Managing and minimizing side effects. If you decide to use NuvaRing as your chosen method of birth control, there are several strategies you can employ to manage and minimize side effects. Firstly, it's important to give your body time to adjust to the hormonal changes. Many side effects, such as mood swings and breast tenderness, tend to diminish after a few months of use. If you experience nausea or stomach upset, try taking NuvaRing with food. This can help alleviate gastrointestinal symptoms. Additionally, if you are prone to headaches, it may be helpful to identify triggers and take steps to avoid them. Stress management techniques, regular exercise, and a healthy diet can also contribute to overall well-being and potentially mitigate side effects. Alternatives to NuvaRing. If you find that NuvaRing is not suitable for you or if you experience intolerable side effects, there are alternative hormonal birth control options available. Birth control pills, patches, and injections work in a similar way to NuvaRing but differ in terms of administration. Birth control pills are taken orally every day, while patches are applied to the skin once a week, and injections are administered every few months. These methods offer flexibility and can be tailored to individual needs. Non-hormonal options, such as barrier methods like condoms or copper IUDs, are also available for those who prefer hormone-free contraception. Consultation with a healthcare provider. Before starting or changing any contraceptive method, it is essential to consult with your healthcare provider. They can assess your medical history, discuss your options, and help you make an informed decision. Your healthcare provider will consider factors such as your age, medical conditions, lifestyle, and personal preferences to recommend the most suitable contraceptive method for you. During your consultation, don't hesitate to ask questions and voice any concerns you may have. Your healthcare provider is there to provide guidance and support in choosing a birth control method that aligns with your needs and priorities. Remember, each person's body is different, and what works for one individual may not work for another. Legal aspects and lawsuits related to NuvaRing. In recent years, NuvaRing has faced legal scrutiny due to allegations of inadequate warning about its potential risks. Several lawsuits have been filed against the manufacturer, claiming that NuvaRing has caused serious health complications in some users. While it's important to be aware of these legal aspects, it is equally important to note that the majority of NuvaRing users do not experience severe complications. If you have concerns about the safety of NuvaRing or believe you have experienced adverse effects, it is advisable to consult with a legal professional who specializes in pharmaceutical litigation. They can provide guidance on your specific situation and help you understand your rights and options. Support and resources for women using NuvaRing. Navigating the world of hormonal birth control can be overwhelming, but there are resources available to support you. Online forums, support groups, and websites dedicated to reproductive health can provide a wealth of information and a platform to connect with others who have similar experiences. Additionally, your healthcare provider can offer guidance and answer any questions you may have. They can provide information on potential side effects, discuss alternative options, and offer support throughout your contraceptive journey. Remember, you are not alone in your decision-making process, and seeking support can make a significant difference. Conclusion: making informed decisions about hormonal birth control. When contemplating hormonal birth control options, the decision-making process involves a careful evaluation of the potential benefits and risks associated with each method. NuvaRing stands out as a convenient and effective contraceptive solution, offering a unique approach to birth control. While it provides numerous advantages, it's equally crucial to be well informed about the potential side effects and risks associated with its use. NuvaRing operates by releasing a combination of hormones, estrogen and progestin, into the body to prevent pregnancy. Users often appreciate its ease of use, as it only requires insertion into the vagina once a month. However, like any medical intervention, it's essential to be aware of potential drawbacks. Common side effects of NuvaRing include nausea, headaches, and breast tenderness, which are generally mild and tend to subside as the body adjusts to the hormones. However, it's equally important to be mindful of more serious side effects, such as an increased risk of blood clots and cardiovascular complications. These risks can vary based on individual health factors, such as age, smoking habits, and pre-existing medical conditions. To make an informed decision about whether NuvaRing is the right choice for you, actively engage in arming yourself with knowledge. Consult with your healthcare provider to discuss your medical history, lifestyle, and preferences. Your healthcare provider can provide personalized guidance, taking into account potential contraindications and your unique health profile. Remember, individual responses to hormonal birth control methods can vary significantly. What suits one person may not be the best fit for another. Actively listen to your body, monitor any changes or symptoms, and promptly seek medical advice if necessary. Hormonal birth control is a highly personal decision, and finding the right method may require some trial and error. It's crucial to approach this journey with patience and understanding, knowing that with the right information and support, you can navigate the potential risks associated with NuvaRing and make choices that prioritize your health and well-being. Regular check-ins with your healthcare provider, open communication about any concerns or changes you notice, and a commitment to your overall health will contribute to a positive and well-informed experience with hormonal birth control.